Thank you, Mr. Chairman. Would also like to thank all the panelists for their testimony today and their service to our veterans throughout the country. And as I represent the veterans in El Paso, I'd also like to thank Mr. Goldstein. The American Legion worked with the local commander, Mr. Britton, to set up a command center to connect veterans there with health services like those that we're talking about today, as well as benefits. And by every measure, most importantly, in talking directly with veterans, it was very successful. So I want to thank you. I want to thank Dr. McCarthy. She mentioned the Mobile Vet Center and other resources that are being directed to El Paso, all of which I think should tell us that we had a problem in El Paso that we're now belatedly trying to correct and to fix. And during that time when especially access to mental health care was so problematic, I had the opportunity to meet a young veteran named Nick D'Amico and his mom, Bonnie, who came to a town hall meeting of mine. And Nick was having a hard time accessing mental health care services at the El Paso VA and shared that with me and my team, but also was there to hear veterans who served as far back as Korea and Vietnam and the Gulf War share their frustration with not being able to get into the VA. As he was driving home with his mom, Bonnie, from our town hall that night in September, he said, you know, I'm having a hard time getting in, and I'm a young, new veteran. Some of these guys have been trying for years and can't get in. And 4 or 5 days later, Nick D'Amico killed himself. And I've got to connect the lack of access, the delay in care, which turns into denial of care, to Nick D'Amico's death. It is at least partially responsible. And yet in that time, the El Paso VHA and the National VHA was telling me that things were under control. And as recently as May 9th of this year, the director of VHA told me that there was 0 days wait time on average for a veteran seeking mental health care access in El Paso. And what I take that to mean is that no veteran waited more than 14 days to do that. The discrepancies between what we were hearing from people like Mr. D'Amico and the VA were so great that, as I've told this committee before, we initiated our own survey of mental health care wait times, found that the average wait time was 71 days, found that, like Dr. Matthews told us earlier this week, more than 40% of veterans stopped trying to seek mental health care because it was too frustrating, and fully 36%, 1/3, could not get an appointment at all. And so I want to ask you, if you had known that the average wait time was 71 days, or as your own VHA audit found last month, 60 days, but certainly much longer than 14 days, if you knew that, as we know now, we have the worst wait times in the country for access to mental health care for new veterans, the worst as of June, what would you have done differently? You said in your opening testimony, we are fully committed to providing accessible care. You obviously did not have that in El Paso. If you had known all this, what would you have done differently?
Congressman O'Rourke, I had the opportunity to visit El Paso. I had a visit there in June the 16th and 17th, and I know that at some point we're going to talk to you about that visit. What has happened in El Paso is tragic. There were 5 psychiatrists that left all at once. That left a huge hole in the ability for them to continue to provide mental health care.
Here's what I'm trying to ask, because I have limited time. What the VA was telling me, and perhaps you, and the veterans in El Paso, was one thing, which turned out to be untrue and was very different from what reality was, which was that there was terrible access to care for veterans who could get it, and 1/3 could not get into mental health care at all. So if you had known that in September of 2013, what would you have done differently?
I would have assisted you with huge infiltration of kind of resources, but also telemental health services. I continue to provide care even while I work at VA central offices by telemedicine, and that's the kind of thing that we can help for places that are having a hard time recruiting. So deploying a system of being able to help.
You would have expanded capacity. We would have had greater access. People
Yes,
like Nick would have been able to get in to see somebody.
So
given the fact that we were not told what the real conditions were, and certainly the VA in El Paso and the VA in Washington, D.C., Director of VHA reported different numbers to me, to the veterans in our community. Who is accountable for that? What are the consequences? Who's responsible?
I'm not prepared to answer that question. I'm sorry. I'll be happy to take that one for the record. I don't have a name.
That is my case in point. No one, you can't tell me who's accountable. There are no consequences for veterans dying. Nothing's going to change as long as we still have the same mentality and culture at the VA, which you exemplify today in your testimony. The fact that you cannot tell me who is accountable for this, that there are no consequences, that you agree that if you had known the truth, you would have done something different and arguably people would have survived who are now dead, and yet there are no consequences. I appreciate the surge in resources, the additional providers, your flight to El Paso in mid-June, but unless we change the culture at VA, this is going to be a temporary fix that will not last. Mr. Chair, I yield back.